thanks for taking time just to slip away from Mum's bedside. I just think it's probably, look, she's asleep now. We've actually given her something for pain, so she's probably just going to need to have a little rest. It's been a pretty tough night. So obviously Mum's been in and out of hospital quite a few times. Yeah. So what's been happening that maybe's been different this time?
I think she just became really anxious,
yeah.
And you know, she was complaining of pain, and the medication that we had wasn't helping, and as she got more and more anxious, you know, then I noticed she was breathing really quickly, and I just got really worried because I'm not a nurse. I don't know.
And it's pretty frightening when people can't take a breath.
Yeah,
it's pretty scary, isn't it?
So I thought, you know, what? I just didn't know, so I just called the ambulance. And
sounds like you did exactly the right thing. Well, I think that's a perfectly reasonable thing to do. I guess my what I kind of wanted to find out from you is how much the doctors have told you about your mum's illness. She's obviously been sick for, what is it, about 3 years now.
Yeah.
So what have they been telling you about her
well,
illness?
Not a lot.
Okay.
You know, like she started off with breast cancer, and you know, she had the lump out, and then she was on medication, and she had some chemo, I think, or she had chemo, and I think then she was on medication, and then they said something about it wasn't working anymore.
Right.
So it's just been.
So you've sort of been getting little bits and pieces,
you know, and basically now it's keep her comfortable.
So what do you understand by that? What does that mean? What do you think that means for you and Mum now?
I can only think that it's not good. You know, like if someone says keep her comfortable, and you know, and they've given her pain medication, then I can only think it's not good. But it's really hard. You know, like she says to me, Julie, what's going on?
Sure.
And
you don't know what to tell her.
I don't know what to tell her.
Yeah. So what do you think Betty understands? Has she sort of given any indication that she's known that she's maybe getting a little bit sicker? Has she given you any cues around that?
I think the last couple of days she says she's more tired. Yeah, she was saying she was more tired. Before the last few days, I would have to ask her if she wanted something for pain.
Sure.
And now she was asking for it.
Right.
More.
So there's just a little bit of a change there.
Yeah.
Look, it's really hard for us to know absolutely where people are at in terms of their illness. But there are certain things that when they start happening, we have to start to be planning, I guess, for the end of life. And that means that we can put some really good care in place so that Mum doesn't have pain, she's not struggling with shortness of breath, that we maintain everything, and we really make, you know, it as best as we can under the circumstances. That's what I guess what we mean by comfort care.
So are you telling me that this is the end?
It might be. And like I said before, sometimes we don't know. Sometimes people do have an infection, or there's something acute that's happening that we can reverse, and sometimes we can't reverse it. So it's kind of like we hope for the best, but we plan for the worst. And by having things in place in a timely way, it means that we can support you, we can support your brother, any other family that need to be supported. We can support Betty. We can certainly really make her care as individual as possible. And you know what? If she does bounce back, great. But if she doesn't, then we've got things in place to make her care as best as it can be. So you know your mum. You've obviously been caring her for a while. So what do you think? You mentioned, you know, managing her pain. Are there other things that you know would be important for Mum right now?
I think she'd like to see me.
She'd like to see your brother.
Yeah,
Okay.
I think she
Okay.
would.
Okay. Well, that
She talks about him a lot.
yeah. And she's bound to, you know, be starting to ask for family that perhaps she hasn't seen for a while.
Is there anything, if I'd called earlier or got her seen to earlier, you know, was there something that I missed?
Not at all. Not at all, Julie. This is quite typical of this kind of illness journey, and you know, look, she's obviously been beautifully cared for. You know, her skin's in great condition. She's, you know, she looks as good as she could under the circumstances. You've obviously been giving her really good care. So I'm pleased. You know, I don't think you can beat yourself up about. I mean, you will, because that's human nature. And that's part of the reason, I guess, I want to call on some of our team. We've got pastoral care workers, we've got social workers. Our social workers, for example, might be able to help organise your brother to come and see you. If you need accommodation at the hospital, you know, whatever you need so that you can be here for mum and be supported, we want to put in place. So, you know, you need to let us know the things that are important to you and important to mum. So those are the sorts of things. I guess that's why I wanted to have this conversation. I wanted to give you some time to talk to your brother, to maybe talk to your husband, talk to the grandchildren, whatever you think is appropriate for your family. But I wanted to give you this time. And like I said, you know, I don't have a crystal ball, so we don't know really how long this is going to take, but there's certainly lots we can do for mum.
Do you think I'll be able to take her home again?
Well, you know, that isn't impossible, and if that's something you really want to do and that's something that Betty wants, we can call in the specialist palliative care team, and I mean, we can get oxygen at home, we can get electric beds at home, we can certainly get her a pain regime that can be managed at home. If that's something you really want, and you think it wouldn't be too traumatic to move mum now, we can look at that. I guess we have to weigh up the whole benefit and burden, and certainly the way I'm looking at Betty today, I'd be really concerned about moving her. You know, I think she has really turned a corner in the last 24 hours, and I would be concerned about transporting her in an ambulance and, you know, all of the sort of trauma associated with that. So, you know, I guess we have to weigh that up, and you know, you need to let us know what you think's best for mum. I mean, we'll do our best, you know, to meet those.
Yeah.
I mean, the reality of it is where she is in this bed at the moment. You know, you can bring in things from home. We can put some lovely pictures on her bedside table. We can pop some blankets from home. You can bring in flowers, cards, whatever you think is going to make this space as homely as possible. Does she have any pets?
No, not now.
Oh, okay. But, you know, we had a little dog come in last week to see a gentleman that was in the same sort of situation. I mean, we can pretty much sort things out and make this as homely as possible. It's just really about doing it in a timely way. I guess you tell us what you think you might need, and we'll put it in place. There's some really practical things we can do as well, like, I don't know if you've noticed, but mum's not eating and drinking a whole lot. And that's pretty normal for someone as sick as she is. But, you know, we can get you helping us give her mouth care, we can massage her hands and feet, you can help us with personal care if that's something you want to do.
So she's been, you know, like I didn't really have to do a lot of that because she was, you know, no, Julie, leave me alone, you know, I can do it. And so I thought, well, I won't bother her.
Yeah, well, it's about privacy and dignity, and you know, we want to involve you in a way that's appropriate for you. So if you haven't been managing, say, mum's toileting, you know, we're not going to ask you to do that. You know, now she's so sick. But, you know, I also don't want us to be a barrier between you and your mum. I know the hospital has visiting hours, but we're going to waive those. And if you want to stay at her bedside, we've got a pull-out bed that you're welcome to use. So, as I say, whatever you need. Has got any immediate worries that are on your mind? Anything that right now you're thinking, oh, I wish I asked that? Or...
I just keep thinking to myself, it's not good, is it?
It's a tough time. It's a tough time. But please use us as a support. That's what we're here for. And just know that your mum is getting great care. Even if we're not doing the OBS every 4 hours like we were, or if we're not taking pathology, it just means that our goals of care are a little different. And doing things to mum that aren't going to improve her situation is pretty pointless. So if you see changes like that and it worries you, you just need to tell us. And usually we can explain why things are different. Right. That's all I can think of for now, and there's a lot to take on board. But look, I'm on duty till midnight, so obviously I'll be in and out giving mum care. But if you think of